A new pilot program will aim to provide holistic support to Medicaid patients following hospitalizations in the North Country. Little MTCM, or Medicaid Transitional Care Management, is being launched by a group of North Country Initiative primary care partners. The program is modeled after a similar service for Medicare patients, where those discharged from the hospital are given specific services to fit their needs, a care manager, and more information to help them in the future.
Effects for our Medicare population nationally and certainly locally, where we've seen the post-discharge hospitalization readmissions and the total cost of care decrease significantly. So in other words, patients who get a discharge from the hospital and they get a TCM service, they fare much better in the 90 days after their discharge than patients who don't get it.
Program leaders agree that this pilot could not be more timelier. During the COVID-19 pandemic, those requiring hospital stays were sometimes prohibited from having support persons, family, or friends, leading to feelings of isolation and anxiety.
I think, that lonely feeling when you're most vulnerable is highly anxiety driven. And we know very clearly that anxiety levels and stress levels interfere with healing.
What this does is it sort of surrounds the patient with support. And particularly if the patient was in the hospital alone, think about how confusing sometimes that situation may be. When you're receiving discharge instructions, you might not be able to really fully internalize those, especially without any other family members or support system present.
The program also has the ability to benefit a significant portion of the North Country. The U.S. Census American Community Survey estimates that over 58,000 individuals in Jefferson, Lewis, and St. Lawrence counties have Medicaid coverage, approximately 25% of the population. And overall, according to both Dr. Leindecker and Loomis, the program will help to improve the quality of care North Country Medicaid patients receive and reduce costs by connecting key community players.
We have generally worked in our own silo, and we don't know a lot about the other organizations or groups or individuals. And really, healthcare done well is primarily relational.
There's so many things that undergird a patient's health that are typically and traditionally not in the wheelhouse, so to speak, of a clinical provider. But more and more, as we learn more about healthcare and as we see the data, we know how much those social determinants of health really do affect your A1C, your weight, your blood pressure. Everything that's coming through in the vitals in an office visit is very intimately related to those things.
If you can do all of that within the context of a need like post-hospital issues needs, post-emergency room visit needs, that's the secret sauce. I think it gives us all incentive to want to participate.
The first of its kind Medicaid Transitional Care Management pilot program is officially being launched in the North Country on April 1st, 2021. Following hospital stays, eligible patients will be contacted by the North Country Initiative. For ABC 50 Now in Watertown, I'm Isabella Colello.